Hi, good morning everyone and welcome to our webinar, Superfood Acai Berry Against COVID-19 Symptoms, How to Harness Its Nutrients. Please welcome on the floor our host, Ms. Regine Tolentino. Ms. Regine, I think you're on mute. Thank you.
There we go. Hello, good morning. Are we good?
Yes, we're clear.
Okay. Today's virtual forum, Superfood Acai Berry Against COVID-19 Symptoms, How to Harness Its Nutrients. That it is of utmost importance to boost our immunity and maximize all the nutritional support we can get, especially in this time of the pandemic. However, with so many out there's so many trendy supplements, how do you know which ones are the best for our body? So today we're breaking down one of the most elusive and promising superfoods of today, the acai berry. In the world of science, the acai berry has been gaining popularity for various reasons. It is a powerful antioxidant, a possible anti-cancer shield, and now is even recognized as a possible treatment in patients. This webinar aims to break down the benefits of this fruit and its promising properties that are being this time of pandemic. As told by researchers and resource speakers from the University of Toronto and the University of the Philippines College of Public Health, or UPCPH, we have first-hand knowledge with the acai berry immune system. Partnership with Organique, an industry leader in making this superfood accessible, we are exploring the acai and the role of this nutritional food in today's health landscape. So the speakers that are with us on this beautiful day, expertise are, we have Dr. Joseph Lee, Dr. Sonny Viloria, Ms. Kathy Salimbangon, President and CEO of Andreazza, and Dr. Michael Farkouh from the University of Toronto. Let's all give them a warm round of applause. He will be joined by Joseph Lee, an esteemed surgeon and urologist who has also done extensive research on the acai. Actually, these doctors are both quite well known because they are the go-to persons for different media platforms here in the Philippines, whether it's online, newspapers, TV shows. They are like the celebrity doctors here in the Philippines. And they will discuss how to protect one's immunity amid the pandemic and beyond, and the potential role of the acai. Hello, gentlemen, doctors.
Good morning, Regine.
Good morning, Dr. Sonny, Dr. Joseph. Hi.
Good morning, Doc Sonny. Good morning, Doc Michael and Anna. And of course, Miss Kathy.
Would you like to share with your opening remarks, your thoughts?
Okay. So what we're talking about, Regine, is about increasing our immune system. We definitely have to cause a strong impact with regards to our defense mechanism. COVID-19 has strongly affected not only in our country, but globally. When you talk about a virus that is novel, which is new, and has already certainly has mutated in several types or species because of its diversity with its proteins, which is very known for the virus itself. We have to, as human individuals or human beings, to be strong with regards to our defense mechanism. One thing, our immune system helps us to protect us from bacterial infection, viral infection, and other immune diseases that we have. or probably that can affect our human body. Okay. Now we all know that the first defense that we have is our blood or blood system, WBC or RBC. Then we have our macrophages, the ones that protect us from invasion. Okay. Then later on, we have the stronger defense mechanism, which is our T cells and B cells, which most of the time we use them as defense for some of our more highly progressive diseases, such as immuno uh, disease or our cancer diseases. Okay, so as an individual, depending on what age range you are talking about, from infancy or even adolescence or even the geriatric age, we have to keep our immune system intact. Intact meaning strong, intact meaning it is highly capable of defending itself to the enemy, especially those which are new and which are coming in very strongly in order to defeat our body. Regine?
Thank you very much, Dr. Joseph Lee. Now we move over to Dr. Sonny. Hi, Dr. Sonny, we'd love to hear from you. Okay, we're waiting for Sonny, Dr. Sonny to come in. Doc, how's our connection with Doc? Okay, so as we wait for Doc to come in, perhaps we can move on to our next speaker as we wait for a better connection. I'll just wait for the go signal from our crew and staff here. If we're ready. Okay, maybe we can get back to Dr. Sonny in a while as we wait for his connection. Perhaps there's some technical difficulties at this point, and do the honor of moving on to our next speakers. So the question is just how much of the acai berry has been explored in the field of science. Ayan. Okay, so we've established the importance of keeping a healthy immune system and what the acai berry has to offer. Role of brands like Organique in our journey towards wellness. Now we'd like to hear from Ms. Kathy Salimbangon. She is the CEO and president of Organique and is an internationally accredited nurse. Her extensive background in the field of medical care means she has a wealth of knowledge when it comes to dealing with different patients and of course experience, particularly the elderly. This makes her knowledgeable in providing guidance to how to such as COVID. So ladies and gentlemen, let's all welcome the lovely Miss Kathy Salimbangon.
Hi, Regine. Thank you
Hi.
very good morning, and good morning to our doctors, Joseph, Dr. Shani, Doc Mike, and Doc Ann, and all those who have joined right now. Thank you for your time. So in this spirit of building an immunostrong Philippines, we want to emphasize the importance of prevention before cure. It's a concept that Organic has always advocated. It puts us in the spotlight of the idea that we don't have to wait until we are sick to find out that we need to do something about our health. This sentiment is what has continuously inspired us to strengthen our immunity by fostering holistic wellness that promotes healthy lifestyle. So that is very transparent in our Facebook Live every Wednesday. We have Wellness Wednesday where we showcase how to live a healthy lifestyle and boost your immune system. When we keep ourselves healthy and well, we essentially do the same for our loved ones and our community. As a nurse and as a mother myself, I really want to focus on starting a healthy lifestyle in the family so that it can spread through our community. Especially now that we have this COVID-19, we turn our attention towards the different ways we can take better care of our loved ones by preventing its transmission. And I believe it starts from home to the community. That is where the Immune Strong PH campaign is all about. And it's all more relevant today than any other events or how many years ago. This is what we really need, a strong immune system. By ensuring that our immune system is healthy and strong, we created a barrier of love, protection around people we care about, especially our families and friends. And bear in mind that is a big part of maintaining a good health is tied to good nutrition. And we make an effort to boost our immune system by eating right and incorporating the right supplements into our daily health routine. We achieve optimum wellness, and we are proud to say that organic can be instrumental for this. A powerful superfood, organic has been a believer in the capabilities of Açaí since 2009 and has since then continued to spread the word about the power of these berries. Now, amid this pandemic, Organique has invited esteemed researchers, Dr. Michael Farkouh and Andreazza from University of Toronto, to share their exciting clinical trials demonstrating the possible use of acai berry properties as a proactive and effective measures against diseases and its benefits for boosting our immune system. When it comes to boosting our immune system, the acai berry is hard to beat, and even with another reason that this makes the Brazilian superfood a part of our lifestyle. This is it. And I'd like to thank also Dr. Sarah, Dr. Anna, and Dr. Michael for sharing their insights on this. And we wish that we will learn a lot from them as well. Thank you, Regine.
Thank you so much, Miss Kathy. Yes, definitely importance of the immune system. So once again, the question, just how much of the acai berry has been explored in the field of science? What do researchers have to say about this superfood and what could make it so promising for treating symptoms of COVID-19 around the world? Here with us today are Dr. Anna Andreazza, professor and psychiatry at the University of Toronto. She is one of the main researchers of the study randomized clinical trial of acai palm berry extract as an intervention in patients diagnosed with COVID-19. Meanwhile, Dr. Farkouh is professor and vice chair for research in the Department of Medicine at the University of Toronto. He is also one of the lead researchers and director of the Peter Munk Center of Excellence in There you go. Ladies and gentlemen, please welcome Dr. Anna and Dr. Michael. Love the applause.
Thank you very much. I think Anna is going to lead off with the background to our trial, and then I'll talk about the trial and take questions. Thank you very much.
Thank you very much. It's a pleasure to be here, and thank you for this warm welcome.
Okay, Dr. Anna, can you go ahead and tell us more about your research and your thoughts about how to harness the nutrients?
Yes, I have. We have some slides to share with you today. If I may please have the slides, it will be great. Thank you. Thank you very much. It's a pleasure to talk to you today about our clinical trial led by Dr. Michael Farkouh and myself, the Açaí trial, the acai berry COVID-19 anti-inflammation trial. Next, please. Once the COVID-19 pandemic started, as a researcher, I started reading about what is SARS-CoV-2, where it comes from, this virus. And I learned an interesting fact, that actually the SARS-CoV-2 originated in bats. Bats have a unique quality. They do not have an NLRP3 inflammasome. What is the NLRP3 inflammasome? NLRP3 inflammasome is this round form shape that you see on your screen that combined the NLRP3 with a protein called ASC and another protein called caspase-1. They all float around in your cells, but once the NLRP3 senses a danger in your cells, activate it and bring the ASC and the caspase-1 together, forming what we call the activation of the NLRP3 inflammasome. This is good in your body. We need some sort of inflammation. We need to protect ourselves. What is not good is an overactivation of the NLRP3 inflammasome, because then we started what we call cytokine storms. And then I learned that this was the culprit of the SARS-CoV-2 inflammation. So I started investigating and asking myself, it is possible that the NLRP3 inflammasome may be present as a novel therapeutic target to potentially decrease the inflammation in patients with SARS-CoV-2. I'd like to remind you that bats that don't have this NLRP3 inflammasome, they are mostly asymptomatic. But when they infect other animals and then humans, we carry the NLRP3 inflammasome, and that may be part of the explanation of the variety of response in society in the COVID-19 pandemic. Next, please. There is a growing evidences in the literature. Actually, so far, there are 42 articles that has been published during the pandemic, and I just highlight 3 of them here for you, demonstrating that the NLRP3 is potentially one of the main triggers of the cytokine storm. Is the only one? No, there are many other alternatives and hypotheses there that are as valid as the NLRP3. We all learning together about the SARS-CoV-2. This is new for all scientists. So whether this hypothesis will hold true or not, we will have to wait and see and test and study more. One of the examples that I'd like to demonstrate to you today is on the bottom of this slide. When you can see there is actually, these are lungs from patients of COVID-19 post-mortem, and you can see a high level of expression of the NLRP3 protein. Quite telling that this is potentially a good way to continue studying that. Next. Then we asked ourselves, why? Why should we test the Acai? Well, I'll tell you a story. I'm actually from Brazil, and I've been working with many researchers from Brazil for many years to try to investigate the effects of natural health products originated either from the Amazon or from the south of Brazil. The effects that I was trying to understand was actually in the brain, because my research focusing understanding how can I find better treatments for patients with bipolar disorder, depression, and schizophrenia. Treating cells with either neuroblastoma cells or neuron-like cells, we start finding that the Acai was actually great to protect the mitochondria. So it tells you, one, it's a good antioxidant. But what we noted as well was that the acai berry was very good anti-inflammatory as well. So we asked ourselves, wait a second, what could be mitigating this activation of the decrease of the mitochondria and decrease inflammation? So we tested in cells and we activate the NLRP3 inflammasome by giving 2 agents. One is called lipopolysaccharide, which is a priming agent of the NLRP3 inflammasome, and the nigericine that triggers the activation of the NLRP3 inflammasome. As you can see in the graphs, the second column is your LPS and the nigericine. The graph A shows you a high level of the NLRP3 protein expression. And when we treat it with the acai berry, it decreases going back to the normal control. But it's very important to hear, it doesn't go down. It doesn't inhibit the complex in a point that we don't want to happen. The orientin is one of the main compounds inside the acai berry. As you can see, it has a very similar effect alone when compared to the total berry, which is good because it tells us that we know how to target moving forward. Next. This is just to summarize everything I told you so far. The NLRP3 inflammasome can be signaling and targeted by several different pathways. One of them, that is what we call signal 2 in this figure, is the activation of a damaged mitochondria, which produces reactive oxygen species. And that was the original theory in my lab to investigate the potential of acai to downregulate the activation of the NLRP3 inflammasome. But as you can see, this pathway is not simple at all, and there are many other triggers that can be actually activating the NLRP3 inflammasome. So with this knowledge in mind and a potential of the acai berry being a safe and a ready available treatment, I connected with Dr. Michael Farkouh and asked him if he would be willing to test that in patients with SARS-CoV-2. What we decide to do is do a clinical trial, and I will pass now on to Mike for him to go ahead and explain to you the trial.
Okay, can I have the next slide? Yeah, so we're going to, it's really a pleasure. Anna, thank you for that wonderful overview. I just want to make sure you can see me here. That was a wonderful overview, Anna. And I think it's exciting that we're going to be establishing whether there is a benefit of the berries in preventing the progression of disease in people who are diagnosed with COVID-19, based on all of the background information and evidence that Anna has presented. Next slide. So this trial is a randomized clinical control trial of patients who are over 40 years of age who have been documented to have COVID positive infection in the last 7 days. And basically, it's a wide open trial for the most part, other than if you have an allergy or hypersensitivity to the berries. And the intervention will be the berries at 520 milligrams 3 times a day versus placebo in 480 patients who are, again, positive for COVID, but are not hospitalized, who are in the community. We'll be evaluating the patients for symptom improvement or the need for hospitalization within the next 30 days. We'll also be evaluating whether they undergo the cytokine storm and whether they have mortality or the need for mechanical ventilation. The beauty of this trial is it's done remotely. We can access the patients who have been deemed to be positive by remote access, consent them, ship them the drug or the counterpart placebo, and assess the patients from their own home in 240 patients treated with acai berries and 240 who are treated with placebo. We again are sample size in the initial phase, 480 patients. Next slide. So you can see here the flow of the patients. They're eligible. They're then approached as in their outpatient phase, randomized to one of the 2 arms, and then there'll be an initial phone contact and then contact with them at day 1, day 15, and day 30 for their clinical status. And that's it. And the trial first phase should be completed, we hope, by the end of the first quarter of 2021. I'm going to stop there so that we can take questions. We expect the first patient to be enrolled in the next few weeks, and we think this trial will lead to potentially a large international study that will involve many countries. The first phase will be conducted in Canada and in Brazil.
Thank you so much, Dr. Michael, Dr. Anna. Thank you for your insights. Very enlightening indeed. You truly have given us hope that science will help us recover from this pandemic, hopefully very, very soon. Now, since we had Dr. Sonny Viloria, once again, if everything's all good, so we can hear a few words from him. Dr. Sonny?
He's on mute. Okay. There you go.
Naman.
Are we
Hello?
Dr. Sonny?
Yes, can you hear
Okay,
me
we're
now? Can you hear me
Yes.
now? Okay. Sorry about the problem. No? Anyway, I just would like to share with you my experience with the acai berry because I've been using this for more than 10 years already. No, most of my patients are already have comorbid condition, diabetic patients, kidney problem, heart disease, lung problem, and so forth. And as we all know, this kind of patients have immunocompromised, particularly if they've been suffering for so long. Now, the thing about it, when I talk about acai, using that for the how many years, 10 years I mentioned, it helps them to boost the immune system. As we all know, particularly diabetic patient, after 2 3 years, then complications comes in already, but somehow it delays the arrival of these different complications. Now, if I'm going to try to look at it now, the way I see it, acid berry can be on a two-prong. One is to boost the immune system, and second, from my research, it was said that most of those who die from from coronavirus have hemangioma or bleeding, particularly in the lungs and in the heart. And then knowing acai is very rich in what you call the anthocyanin, that's why I used a lot of acai patients, particularly for patients for bypass angioplasty, and then they're not anymore undergoing the same experience or operation. No? So I think it can help a lot on that aspect. First of all, it could be prevention of the complication, and foremost is the improvement of the immune system, boosting the immune system. It may sound anecdotal, but this is the reality of my 10 years of experience of working with acai. That's all.
Thank you so much, Dr. Sonny. Thank you for sharing your experience and your research as well. Okay, we've heard a lot this beautiful afternoon, this morning. And we'd now like to move on to the question and answer discussion. We'll be opening the floor for our audience. And we already have a few already right now. We'd like to turn this one over to Miss Kathy. Can you tell us how you discovered that the acai is a superfood that you want to offer to the public? And can you tell us, Miss Kathy, how accessible is this superfood, the acai berry?
Thank you very much, Regine, for your question. Actually, we used to live in California. I work as a nurse there. So we discover acai there because my husband used to work in a nutraceutical manufacturing company that manufactures all these healthy organic products in California, distributed worldwide. So I've seen how lifestyle can really affect our diseases when we get old. So I have the privilege to talk to the team in that nutraceutical company, like the food scientists, the chemists, nutritionists, and I asked them, what is the for you guys, what is the superfood that is available that's really good for preventing all, it may sound again anecdotal, but preventing some diseases, no? And they all agreed that acai berry is by far the highest in the highest category of superfood. So then we decided, okay, since in the Philippines, the hospitalization, the medical bills are very high here, and it's not even free, so only few can afford. Might as well offered it in the Philippines. I was still working as a nurse in California. So we decided to migrate and tap on this as the benefits of acai berry. And that time, we have to use our formulation and all the stuff because the Filipinos have different taste, no? So they want a bit sweet. So for us as a nurse, I was thinking if we want to offer something, it has to be palatable in the Philippines, and it has to, you have to continuously use it, because there's no point when you have to close your nose and try to drink that supplement. It doesn't, it's not healthy per se. You're not happy, you're not looking forward to take that supplement. So we have to formulate it to suit the taste of Asians, especially for Filipinos. And you look forward every day on taking it for the rest of your life. So that's why we decided, we also decided to go for aseptic technique, which is no preservative, no additive, so that when you take it on a daily basis forever, your liver and kidney will be protected because it's a clean product. And then here in the Philippines, we distribute it worldwide so that it will be accessible for all the Filipinos in all places. Thank you, Regine.
Yes, thank you, Miss Kathy. So I have another question. You know how they always say prevention is better than cure. Can you tell us how the Acai can help?
Okay, of course, you start. I'm a proponent kasi of prevention, not on the cure side, because I've seen on our practice in the nursing home that there's a lot of lifestyle diseases that can be prevented when you live at the early, like a younger age, healthy living, right? Like diabetes, you have to make sure your food, for example, for diabetes, you have to make sure you have at least low sugar, not so much on the pastries, the ice cream. So there's a lot of things that you can prevent before you develop all this high blood, diabetes, and sometimes, of course, cancer, because of healthy eating and healthy living. And I believe it's not only on the food per se, but also the environment, also spiritual, also emotional aspect. It really is a holistic approach of healthy living. Thank you, Regine.
Wonderful. Thank you for that. Now I'd like to ask our two local doctors, or celebrity doctors, Dr. Viloria and Dr. Lee. Do you have any official studies or agencies that have proven the efficacy of acai and its benefits? And can you tell us why should more people include acai in their healthy lifestyles? Like, should it be a daily thing?
Yeah.
Care to share?
Yeah.
Let's start with Doc Joseph.
Okay. All right. 5 years ago, I had a experience when Kathy was presenting to me acai berry. We did a short study. Okay, my experience is not as broad as Dr. Sonny, but my for the last 5 years that we from the time that we did a very short clinical study, the main objective was to see on its basic blood chemistry, can acai berry see or show a significant difference or reduction. So we tried getting at least a series or selected randomized number of patients, okay, more than 30, okay, significantly. Most of the patients were selected with conditions of hypertension, high hypercholesterolemia, obese, okay. Then some of them have prostate problem because, as you know, I'm a urologist, so I have to include some of my patients with BPH, okay. Then we look into some cases, there's a mixed cases of patients with high levels of liver enzyme. For the 3 months that we did for a short duration of clinical trial, we show Doxani a significant reduction with regards to sugar levels, the blood pressure for patients who are hypersensitive were more or less stable and did not cause any erratic manifestation, even though they are on maintenance. Because some, for the fact that some of our patients, even though with maintenance, because of the external factors or stress factors, you can initiate a level of high blood pressure. So more or less the blood pressure levels were normal or stable. The liver enzyme SGOP and SGPT were used, even alkaline phosphatase. More or less, they went into normal levels. Okay, especially what is significant, Regine, was the triglyceride and total cholesterol. So you're talking about basically, okay, I think Doc Sunny will agree, all the ingredients that have been said about acai berry significantly affect blood sugar levels, okay, liver enzymes, okay, your cholesterol levels, and of course it monitors, it stabilizes your blood pressure. So for hypertensive patients, so like what Dr. Sani was mentioning, you talk about respiratory, you talk about cardiovascular disease, you talk about probably GI later on, which significantly your acai berry with all its potential and potent ingredients, like Dr. Sani has mentioned, the anthocyanin. Besides that, you have your flavonoids, your theobromide, your phytophenols and sterols, and omega-3, 6, 9. It really significantly changed the level of blood picture that we are seeing. So at that point, Regine, I told Miss Cathy, I think acai berry at this point has a potential good effect for one, human consumption. Second, there would be a change probably if you will have long-term intake of your acai berry juice. Okay? Do you agree,
Yes.
Roxani?
Yeah, yeah. I would just to share with yeah, I would like just to share with you. Most of my patients are categorized already as immunocompromised, particularly cancer patients, but patients with diabetic complications, kidney patients, and those with cardiovascular diseases. No, patients bound for bypass or angioplasty. And so far, the result using acai berry is very, very good. And I just like to add, no, I having been in the practice for the past 10 years, no, I never had any, and most of my patients, I forgot to mention, are elderly, 60s and above. No, 80% of my patients are elderly. No, I never had anyone complain that any of them, because I've been maintaining them for so long, that they had that coronavirus. And I'm so happy for that because they're just maintaining acai berry, because it's not only good for those with a health condition, but rather it can be more, let's say, more on the preventive side. Particularly, again, it's for the boosting of the immune system. And everybody know, as we have been explaining the whole period right now, the key to prevention of the coronavirus is to boost the immune system.
Fantastic. Thank you so much, Dr. Sonny. There you have it. Dr. Sonny, Dr. Joseph, our go-to resource persons here in the Philippines. Thank you very much. Now let's Miss Cathy. Can you tell us, Miss Cathy, what made you decide to invite Dr. Farkouh and Dr. Andreazza to have this talk with us here in the Philippines? Meant to have the DOH, like how you guys, for organic, endorses their BEDA campaign, right? Can you also tell us what are the lessons and insights that you want to emerge from this discussion today?
Actually, Regine, thank you for that question. Actually, I'm very honored to be here with Canadian researchers at the same time for Anna, Brazilian nationality, because we have very close relationship with our Brazilian suppliers. And I used to work and live also in Toronto. So now that we are in the Philippines, it's really an honor to have them to connect, the people worldwide to have a good cause for which highlighting Açaí for our Immune Strong campaign. And also we work really hard to spread awareness about the superfoods capabilities of Açaí. So right now, Organique have been working closely with DOH in line of public awareness of this COVID-19 and also its effect on our immune system. So when we heard that Doctors Farkouh and Dr. Anna have been studying the possibility of acai as helping lower the impact of COVID-19 in our immune system, we wanted to hear from them, especially following their clinical trials that noted the efficacy of acai against COVID-19 symptoms. So we were compelled to invite them for our talk as we continue to look for more ways to protect ourselves and our loved ones from this raging virus. Hopefully, after this, we will all leave the talk feeling empowered and encouraged that with cooperation and good health, we can overcome this pandemic. Thank you very much.
Thank you. Yes, yes. Can you add to this, Miss Kathy? Of all the available fruits and superfoods in the market, what made Organic decide to go with the acai berry? Actually, the answer is quite obvious from our discussion today, but can you expand a little bit more on what makes it stand out from other nutritional supplements?
Actually, we go back to when we started. When we were in California, and then we migrate here in the Philippines. We ship, I think, 660 bottles of different superfoods. I will not name some, but actually we tried and tested all these type of superfoods. I have some friends who are sick, who have flu, and then I give different, these 3 different fruits. It's acai and 2 others, which is very popular right now. And then I really see the effects of acai, a very, profound effect of acai for my friends or my families who have been sick that time with flu, no? The other are not so. The 2 other superfoods are not so. So I talk to my husband and say, you know, if we want to offer and help the community, we'll really champion on this acai because I've seen it in my eyes. I've heard from the feedback of a lot of our friends that in 10-15 minutes when they had flu, even for myself, when I came from my flight from Manila, I remember Manila to Cebu, I was, having a really bad flu. And when I started taking acai, in 15 minutes, my nasal congestion loosened, my headache, my head feels like, the pain because it was so throbbing. So, if I enjoy this superfood, I'm willing and very happy to spread it to the community, of course, because that's our advocacy. Thank you, Regina.
Thank you very much. Yes, that's wonderful. What is the importance of having nutrition options like organic, especially at this time of pandemic, Miss Kathy?
Actually, acai is not available in the Philippines, and the only way to have access on that is through the supplement, which we have on this organic. Organic has been processed without preservative. Actually, the journey of this organic supplement come from Brazil, and then we have to ship it frozen to California, and then process it there on this aseptic process, which is no preservative, no additives, and this will last the freshness would last for 3 years, and then ship it to the Philippines, all bottled. So, what we're saying is, since acai is not available, the fruit itself, we have this organic to offer to the table for all the families and the community to really enjoy the benefits of it, no? And with its safetiness because of no preservative, it's USDA certified, which is we're really proud of. It was so hard for us to get that certification. Thank you, Regine.
Yes, absolutely. Actually, I've had the privilege of using this product for the past several years, and as a busy, I tell you, it's great to see the benefits of myself personally, how when I have taken it, like how it has helped me to be strong, and my immune system has been great. Thank God I haven't gotten sick in several years. And just to be working with Miss Kathy and Dr. Joseph for the past several years, even Dr. Sonny, like we've had so many case studies of people who've taken it and like how it has changed their lives. So it's just so amazing how we're pulling it all together. And what persons with us today, aside from Dr. Joseph and Dr. Sonny, are these two from Toronto, you know, from halfway across the world. And it just so happens that their study is just so perfect for our topic today. So I'd like to ask you both, Dr. Farkouh and Dr. Andreazza, how did you make the potential connection between the COVID-19 as your hypothesis in search for new drugs to fight the virus? Why did you decide to turn your attention to this popular superfruit? Let's start with Dr. Michael.
I'll let Anna was the one who came up with the hypothesis, so I'm going to ask her to explain it because I'm just here to perform the trial.
Okay. Dr. Anna?
So I was studying the potential of the acai berry in my lab as an antioxidant and a potential anti-inflammatory in cells of that are neuronal-like cells. Start as we discussed in the presentation before. I started reading about the SARS-CoV-2 and noted that also target the NLRP3 inflammasome. So I decided to contact Mike with this wild exploration of whether this berry could potentially help patients with COVID-19 because it decreases the activation of the NLRP3 inflammasome. But it's very important, Regine, to tell that we don't know the answer yet. So as much as we know that acai, it is a superfood, is a great antioxidant, we do not know whether it works for treatment of any of the symptoms of inflammation in patients with SARS-CoV-2. So we have to be careful to not to say today or make any statements that we should be taking acai for COVID-19 because we do not have results yet. As Michael very well said, is we need to wait for the trial to be ready to know whether there is a potential or not. But hypothesis seems strong. I'm confident. Let's wait for the trial. Mike, I turn to you.
Yeah, I think that we are very interested in this era to work collaboratively across our. Am I on this? Can you hear me? Yeah. So we are working collaboratively with our basic scientists, clinical scientists. It's a new era of collaboration to explore novel therapies. And this is a novel therapy. And we think that it has the potential to be used widely across the world, relatively cheap in terms of cost, well tolerated, and it may make a big difference in the kinds of trajectories that are occurring with COVID infection around the world, particularly in countries where they can't afford all the expensive therapies that we're giving to folks in Canada and the United States.
Okay, absolutely, that's right. It's all still in the process of being tested. What do you think, both of you, Dr. Michael, Dr. How do you see this impact on a country, let's say, as per se, the Philippines?
Well, again, if we can prove that it's effective in preventing the complications of this virus, then we can give this widely to folks in the communities. And instead of us hospitalizing patients and treating them with expensive therapies, we can prevent a lot of this deterioration. I think it holds that promise, and it's novel, and it is exploring science at its greatest benefit.
Okay, wonderful. Would you like to add anything, Dr.
No, I agree a lot with Mike. I think innovation is necessary in any field, and I love it. It has been just an incredible pleasure to be working in such a collaborative environment. It's wonderful to see that doctors like Dr. Michael Farkouh is open to novel and innovative ideas. So it gives me hope for science, for collaboration and innovation.
Can you share with us your timeline for this Açaí study in treating COVID-19 symptoms? Is it still in testing stage? Have answers within the next, let's say, 6 months or so?
Yeah, I think that's realistic. I think within 6 months, we'll have an answer in the first 480 patients. We're looking for a signal. And if it's there, then we can roll this out widely. And the other promise that we haven't talked about is whether it actually prevents the infection in the first place. That's a novel concept. We believe that it works once you have the infection, but it may have health benefits beyond that. And the other thing to remember is that once you have COVID infection, there may be long-term effects of the virus 4 or 5 years later, and this may also mitigate that as well. And we will evaluate patients in the long term in observational follow-up as well.
I'd like to go back to Dr. Anna. We have a question here because in an article stated in CTV News, it's reported that your study found that acai has mental health benefits too. Can you please elaborate? I know you mentioned this earlier, but can you tell us a little bit more about how exactly can acai help improve mental health?
Exactly, no, no one knows.
Okay.
But I can tell you why we went into this. So I've been, from my research career, I've been studying how the energy metabolism, so you know the mitochondria in our cells produce the ATP, which is our cellular energy. So this cellular energy is very important for our neurons to keep processing neurotransmission. If we lack proper energy production in our neuronal cells, our neurons cannot communicate, so you're going to experience probably cognition problems, memory loss, or if they produce too much neurotransmission, you have the opposite. You have mania, you have an excitation of neuronal transmission. So been working and trying to find ways to prevent and to ameliorate this dysfunctional mitochondria in patients, mainly with bipolar disorder. We have studied several other drugs in my lab, but one that is very interesting is the acai berry, because it's a very good antioxidant. So it has the capacity of regulating the mitochondria in the neuronal cells, and potentially have an effect of attenuating this going up and downs that we see in patients with a bipolar disorder by regulating their neurotransmission. Never been tested in patients, have been testing animal models, cellular models, but not yet in patients. So again, same thing, we don't know whether it works or not yet for patients.
Yes, it's soon. Thank you very much, Ms. Dr. Anna. Okay, now let's go back to Dr. Gentlemen, as health experts, how do you describe of health awareness here in the Philippines? What are our strengths? What are our improve them?
Okay. I think, Regine, what we have, COVID-19 has taught us that prevention is top priority with the lifestyle change, okay? It has taught us and not really push our insight with regards to health and wellness, okay? If you try to see globally, they have been imposing and a lot of protocols has been given with regards to how to medicate COVID-19, either risk cases or critical cases, or even mild to moderate cases. They have used, for the fact regime, several drugs. One famous is Remdesivir, which is not yet proven, but it's quite famous globally. But what we're saying is like what Dr. Michael and Anna is doing is like, it might not be proven yet with acai berry, but in longer clinical study, it will show that indeed it will help change the paradigm of how we treat our elderly patients, like Dr. Sonny is mentioning, and especially those who are critically ill It's always a wondering thing for us, Regine, especially for those who are going into preventive and those who are opting not to go into preventive management with regards to their health. At the onset, you will see that those who are going into preventive and taking potentially good organic supplement tend to live a more healthier and happy life without any illness or whatever. So I think what we need here now, especially in our country, is to change the paradigm shift of not uh, unhealthy or not keeping us unhealthy, but more of prevention, like Miss Katia said, and a total shift of your healthy lifestyle.
Yeah, Doc Sonny, would you like to add to that? Thank you, Dr. Joseph.
Yes. I'll just give you a little trivia, Regine. Do you know that the incidence right now of dengue hemorrhagic fever, the death is only 200, as compared to last year, which is about 1,700. So that's a big difference. No? There is, they say, about 600% decrease. Now, I would correlate this because the people, since the lockdown, I think it started about March, right? At that time, you can see there's so much sales of fruits and vegetables, which as
Mhm.
all we know as a source of antioxidants. I would correlate it with that. So there is now greater awareness that people have to improve their immune system, particularly the use of the antioxidants. No? And then there's I would say there's between dengue and coronavirus, both are virus. Both are virus. It's common, no? Common among them. No? And then with that, on the first place, no, even before the advent of the coronavirus, they are saying that the best protection, according to the WHO, even our Department of Health is saying the best protection for us is to boost the immune system. So I think there is a change in health landscape, no? And then I'll give you another example. Why is it that third world countries like Cambodia, Vietnam, Laos, Thailand have a lower incidence of coronavirus as compared to the other countries? No? It's because of the food and the spices they're using. They're using so much of spices which are rich in antioxidants. And unfortunately, Filipinos are not too much into healthy spices, but rather they use processed foods already, processed spices. No? So I think that's the, again, the formula here is to always try to boost the immune system. And I'm happy to say that that's already a good progress for all of us. However, the scare of coronavirus remains for all of us. Thank you.
Joseph, that's wonderful insights. Okay, so wow, we've learned a lot this morning, this afternoon, so much information and so much hope actually in the stories that you have shared for today. So before we end this very wonderful afternoon, I would love to hear, or we would all love to hear from each and every one of you before we end our program. So let's go ahead and get started with Dr. Sunny.
Yes, of course, we keep on reiterating at the very start, the formula to prevent on coronavirus is always try to help to boost the immune system. How can you get it? Of course, nutrition is very important. A healthy lifestyle is very important. And of course, always it should not be positive attitude should always be there. And protection internally, particularly the use of supplements or antioxidant, and external protection, you have to follow the guidelines being given to us by our government.
Okay. Thank you very much. I love the positive attitude. Of course,
Yeah.
you have to add that in there. That is very, very important. Thank you. Dr. Joseph Lee.
I agree, Regine, with Doxan. I think it's high time that, especially us Filipinos, we shift our health paradigm into more of prevention, take in a lot of good stuff. When you say good stuff, organic vegetables and all those stuff. Um, I think the processed food has to stop and be something of the past. All right. Then health and wellness, I think, will be a good complement when you have a good lifestyle change. Okay. the lifestyle change has to be within yourself. Okay, it is not forced upon. It is not because you've listened to clinicians like Doc Anna or Doc Michael and Doc Sonny, and you just want to follow it for a certain period of time. I think this is a total holistic change in the character of taking in food and how to protect yourself. And like what the rest of the panel is saying, when you protect yourself and keep yourself healthy, you boost your immune system. That is already an equation that we have to get into. Then, when your immune system is totally intact, balanced, and boosted, and of course, you will prevent yourself from COVID-19.
Very much, Dr. Joseph. Very wise words, wise man. All right, let's move on to, of course, Miss Kathy. Miss Kathy, we'd love to hear from you.
Hi, Regine. I think Doc Anna would like to add on Doc Sally's comment. So I'll give Doc Anna the floor before I say my closing message.
Oh, thank you, Kathy. I just want to really commend what Dr. Vilorias and Dr. D actually said about staying healthy and boosting your immune system, because it is true. And I really like your comment about dengue, because it's true not only for COVID-19, it's true for health. So it's a good advice that you gave. And I think that is actually my final comment, is like staying healthy, boosting your immune system, taking a health lifestyle. It is important for everything in your life. I think Kathy mentioned her experiences with the patients in the hospital that she used to work with. So stay healthy, stay positive, stay safe, wear your mask, and we're gonna fight this. Thank you.
We're gonna fight this. Wise words as well. Okay, so let's go back to Miss Kathy.
Thank you, Regine, and thank you, Doc Sunny, Doc Lee, Doc Anna, Michael, for sharing your time and knowledge with us today. We'd like to express thanks for the panelists, the media, and our viewers for participating in this morning forum. This is a time of unprecedented uncertainty. One of the best things we can do is really to invest in our immune system to protect us and our loved ones. But as revealed by our speakers today, we have a really good chance in fighting this COVID-19 and also boosting our immune system. Thank you very much and enjoy the rest of the day. And Doc Anna and Doc Michael, thank you for staying awake. I know it's 12 midnight there in Toronto. Thank you very much, and I really appreciate your time and effort for this.
Thank you, Miss Kathy. Hear a few words from Dr. Michael Farkouh.
Oh, I just want to say that it's a great pleasure to meet everyone. We're here to share in this pandemic all of the hardship, but also the ways to move forward. And we look forward to presenting our data to you in the next 6 months and hopefully working together in the future. Thank you very much.
And giving us hope, and we have better days coming ahead, and we can't wait to maybe perhaps have another forum like this after 6 months, perhaps earlier, to share new insights, new information.
Absolutely.
Updated. Yes.
Thank you. Yeah.
All right. Well, God bless everybody. If you guys would like to add anything, feel free. If not, you can messages here in the forum, and we can get back to you in the future. There you go. I hope you guys enjoyed and learned something new and are inspired to. I think the keywords for today is prevention is the key, Diva. So God bless everyone.
Thank you.
Thank you. Thank you very much.
Everyone.